Hi everybody and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about something that I get questions on a lot and I actually see a lot of confusion about out in the community. And I'm going to be talking about the difference between dependence and addiction. And there is a very important difference between the two, especially when it comes to using medications and particularly using psychiatric medication. The nuances of dependence and addiction within the realm of substance use disorders are intricate and demand a comprehensive understanding for effective management and treatment. As a seasoned medical professional, having navigated through these complexities, I have grown to appreciate the critical differentiation between the two terms, which are often and incorrectly used interchangeably. Now, what is dependence exactly? Dependence is a clinical term that signifies a physical state in which the body has adapted to the presence of a drug or medication. This adaptation is characterized by the development of tolerance, where higher doses of the substance are required to achieve the same effect, and withdrawal symptoms ensue if the substance is reduced or ceased. Though dependence can lead to addiction, it does not necessarily do so, and can occur even with prescription medications utilized in accordance with the healthcare provider's directives. The management of dependence hinges on medically supervised detoxification, where the primary goal is to wean the individual off the substance safely. This is frequently achieved through a carefully monitored tapering process, allowing the bodily systems to gradually acclimate to decreasing amounts of the substance without triggering severe withdrawal symptoms. This treatment modality may be supplemented with supportive care, including medications to alleviate withdrawal symptoms. Okay, so a lot of psychiatric medications will cause quote-unquote dependence. And that includes your SSRIs. Sometimes it can even happen with something like clonidine. You kind of get some rebound effects. If you don't taper off of these medications correctly, that's because your body has become somewhat dependent on that medication. It doesn't know how to work or function correctly without that medication, so it takes it a minute to adapt to not having it. Now, this is a clear difference between addiction, and I'm going to go into addiction a little bit here. Addiction is a formidable adversary, with its hallmark being not just a physical but a strong psychological dependence on a substance. Okay, that is the key difference. Addiction is a compulsion. It's not just having these physical symptoms, but it's a craving for the substance. It's defined by an unyielding pursuit of substance use despite the corrosive consequences that accompany it. Addiction reflects profound changes within brain circuitry that govern reward, stress, and self-control. It is posited that genetic, environmental, and societal factors coalesce to catalyze the pathological pursuit of substance use inherent in addiction. The treatment course for addiction is integrative, extending beyond the detoxification stage. Psychological interventions, including diverse forms of therapy like cognitive behavior therapy, motivational interviewing, and contingency management, are paramount to aid individuals in comprehending the underlying drivers of their addiction, developing coping strategies, and fostering resilience against relapse. Medications too have a role to play, particularly with certain substances like opioids, where they mitigate cravings and restore normal brain function. So let's talk a little bit about dependence and addiction when used together. A critical consideration is distinguishing between dependence and addiction lies in their influence on treatment trajectory. Dependence is primarily managed through medical interventions aimed at detoxification, while addiction requires a more holistic, sustained approach that addresses the psychological aspects alongside any physical dependency. So emerging research underscores the importance of personalized approaches to treating substance use disorders. A study by the National Institute on Drug Abuse highlights the utility of integrating behavioral therapies with medication-assisted treatment for a more robust response, especially in opioid addiction. Additionally, advancements in understanding the brain's reward system through neuroimaging studies are shedding light on potential new targets for therapeutic interventions that could revolutionize addiction treatment. So this is an ever-changing landscape here. There are new treatments coming out for addiction all the time. Now again, the primary purpose of this video is to underscore the difference between addiction and dependence. Addiction, again, it has that psychological factor. It has that craving. You have changed circuits in your brain, in your mind, in your behavior to the point that you have to have this substance. It's not just a process of your body adjusting to not having it, which is the case in dependence. Okay? So, from my own personal experience, I had some dependence on the medication trazodone, which I took for years to help me with my insomnia. Now, it was a process of several months of tapering off of this medication, and I did have some side effects. I did have some, withdrawal from going down off the trazodone. That included things like I was really tired. I also was kind of really depressed. As you know, trazodone has antidepressant effects, so I kind of had some rebound depression symptoms. I had lots of headaches. I had difficulty sleeping without it. But after a few months' time, my body adjusted. Now, did I crave trazodone? Was I there laying around being like, I gotta get some trazodone, I gotta find trazodone? No, I had a bottle of trazodone with me. I mean, I could have taken it if I wanted to, but I was not addicted to trazodone. It was not hard for me to just say, no, I'm just going through a withdrawal phase here. My body will adjust with time, and I don't need the trazodone. Now, with addiction, that's just not what happens. People crave it. They will do anything for it. And it is just not the same thing as dependence. In summary, dependence and addiction, though related, are distinct entities requiring tailored management strategies. So it really is different. You kind of want to wean off both, but with addiction, you probably, want to depend on other medications a lot. I know in my line of work, we do a lot of alcohol detox, even opiate detox. You want to manage those symptoms with other medications, okay? And you do want to taper off of them as you would with dependence. But again, it is a different scenario. Understanding the differences is critical for health to facilitate targeted treatments that address the specific needs of the individual. By continuing to embrace new insights and research on the realms of addiction science, we can refine our approaches and ultimately offer more effective, evidence-based care. Thank you guys so much for watching. I hope you enjoyed this. I hope you have some insight on the differences between addiction and dependence. It is a big difference, and it is an important difference. There are medications in the psychiatric realm that do cause addiction. That includes, benzodiazepines are probably the biggest one. And then there are medications that cause dependence. That would be your pretty much any antidepressant. It would be gabapentin. It would be some other medications that you become dependent on and your body needs to adjust, like the trazodone I was talking about. But then there are other addictive substances still. You've got your sleep medications like your Ambiens and your Lunestas. These can become addictive. So it is important to know the difference and know which medications are addictive and which medications may cause dependence and which medications really might not cause either one. Thank you guys so much for watching this. If you enjoyed the content, like the video, subscribe to our channel for more, and share it if you think there's people out there who don't really understand the difference between addiction and dependence. And thank you guys so much for watching.